Well, welcome back, everyone. Today, I am joined by Dr. Zane W.M. Dean. He's a structural heart director and cardiologist at Lima Memorial. And he's going to talk a little bit more about the TAVR procedure that's offered there. So thanks so much for joining us today.
Thank you.
Yeah, so for those of us that are not in the medical field, what is TAVR?
TAVR is an acronym for Transcatheter Aortic Valve Replacement. This is a minimally invasive procedure wherein a new heart valve is placed in place of a failing heart valve.
All right. So I've heard about aortic stenosis. So can you kind of give us some of the causes or symptoms of aortic stenosis that people should be on the lookout for?
Aortic valve is the main exit valve of the heart. When that gets narrowed, patient starts having symptoms. The three classic symptoms are the 3Ds you look for. The first is a shortness of breath that we also call dyspnea. Number 2 is dizziness. And number 3 is angina, that is chest pain. But the main thing that we are seeing is that patients generally feel a slowing down. If you feel that you are unable to walk what you used to walk last year, or maybe unable to climb a few steps or do your groceries, then you should think that it could be from aortic stenosis.
Okay, so what can a patient expect before, during, and after a TAVR procedure?
This is also a minimally invasive outpatient procedure. You come on the day of the procedure. Actually, before we do this procedure, we do planning for this procedure where you undergo a CT scan to see the size of the aortic valve to use, as well as to see what access to use. Generally, it is done through an artery in the leg. And then this is done in our hybrid operating room in Lima Memorial Hospital. There's a team of doctors working together, which includes the cardiac surgeon as well as interventional cardiologists. This is essentially reboring of the heart valve. The new valve, which is compressed in a thin tube, is advanced under X-ray guidance in place of the old valve, and then it is placed there by inflating a balloon. This procedure itself lasts about an hour and a half. The patient recovers that afternoon, and then generally we keep the patient for about 24 hours. And the recovery is pretty fast because there's no large chest incision, and therefore the patient is able to go home soon and then recovers very quickly within the next few days. In fact, they feel, many times they feel that they can breathe much better very quickly.
Wow, okay. So if someone thinks that they have a heart condition or maybe would like to know more about the TAVR program, how can they contact you?
They can contact us through Lima Memorial Cardiology referral line, and we have a structural heart team and a structural heart coordinator. The numbers are listed on your screen, and we'll be happy to see you.
All right, fantastic. Well, doctor, thanks so much for joining us today. Appreciate it.
Thank you so much.
Well, don't go away because we have more when we return.